Welcome back, everybody. Shoenn with Jude, episode 4, part 3. Yes, we are in the office primarily because the Garden State weather is a little bit hinky today for filming. Plus, I got a bunch of notes with this particular part and want to make sure I cover everything correctly. Let's cover a few things right off the bat. Number one, if you get the American Farrier's Journal or you're interested in getting the American Farrier's Journal, check out my article talking about my return to university, some of my struggles in a particular account, inability to articulate myself well enough with some of the veterinarians that I was trying to collaborate with at the time. So, total need, want, desire to sort of up my game. So that article's out, talks about the study that I did, caudal shifting, backing of the shoe, toe placement, impact on breakover. So I think it's an interesting article. Check it out. Today's episode is we're back in Ashton, Ontario at the Eastern Ontario Farriers Association Clinic. Entitled Living with Laminitis. Um, check out Eastern Ontario Farriers Association on Instagram or some of the other social media platforms. Awesome facility, really forward thinking group of farriers, really wanting to up their game, share knowledge, learn more about their craft, improve their craft, their skill, not only in the forge, but also with these types of events. So they do a number of events throughout their year. They also do a number of events insofar as forging. Some testing goes on for those people looking to get certified. Looks like there's all levels of farriers that participate there. Really, really, you could tell from the other parts, previous interviews, really a cohesive group of people, nice group of people. If you find yourself in that area or they have something forthcoming, definitely worthwhile to go up there and experience what they have to offer. This was my second year. Last year, as I've said, I was a clinician presenting and really, really enjoyed it. And that's why it was important for me to go back and sort of cover it. Definitely a valuable and realistically, as the clinicians point out, very infrequently have I been to clinics here in the States that are that well attended. So, really was a great facility, very well done. Eastern Ontario Farriers Association, their philosophy is the farrier, you attending, should walk away with one thing that you could institute in your practice the next day. So I think that's a great philosophy, super useful for those farriers that are out in the field practicing. You know, you could always learn something and you could always improve your skill. So check them out online. Let's talk about, in this particular part, um, the clinicians discussing living with laminitis. Dr. Alvaro Palacios, originally from Ecuador, worked at Rude and Riddle for a while under Dr. Raul Bras, another veterinarian who is a farrier practicing. I believe he's now at University of North Carolina. Not 100% sure, but I know he did leave Rude and Riddle. Dr. Palacios, super skilled guy, does a whole demonstration with one of the horses there, applying and a venogram, which I'll discuss. Dr. Bob Neff, longtime veterinarian at Fairfield Equine, top guy. So really, really super clinician, super valuable information. Let's talk about laminitis briefly. Fortunately, my practice, very infrequent times have I been working on horses with laminitis. So I'm going to give a brief overview. Maybe at some point in the future with the program, I definitely will have somebody come on talking about laminitis, because it is by far probably the worst thing that could happen to a horse. And in a lot of cases, as is highlighted in the material, some of the video clips that I'll share with you, it could be a death sentence for horses if interventions, veterinary interventions, management, things need to be done in a very immediate time frame in order to, save and possibly stop um, what can happen when a horse founders has laminitis. So let's just talk about what exactly is laminitis. So you have the lamina, basically are like this, supporting the bone, supporting some of the soft tissue. This is the pedal bone, the coffin bone. And basically, it's this severe inflammation that occurs, and blood flow becomes a problem in certain aspects of the hoof. And this bone, because of the load of the horse, it starts to give away from the wall. So I have some examples that I'll show you of what a normal bony column alignment, what a normal pedal bone looks like in a foot, and then a horse that's had laminitis, a horse that has rotated, how this bone sort of shifts away from the dorsal wall here, and you start to see this deviation. In the cases that have really gone, unfortunately, for lack of a better term, south, this bone will penetrate the sole. And it's in those instances when it gets that severe that the horse has to be unfortunately euthanized. It's a very painful thing that could happen to a horse. So let's start off talking about it's an emergency situation. And in this clip, Dr. Neff highlights that.
Or that, when do you do them? Do you really need to do them right away? But I think Alvaro makes a hugely important point. This is an emergency, and a lot of people don't necessarily treat it that way, or they don't necessarily know. They just think the horse is foot sore, but in fact, they're starting laminitis, and so the sooner you can get to them and try and stop that, the better your outcome, the better your prognosis. I've had too many cases where people call up and they're like, "Yeah, we want a second opinion on our."
As was said, is really there's an immediacy. There's this 24 hours that if you have a horse that is presenting some sort of a lameness in the foot, you have heat in the foot, you have a bounding pulse in the foot, it's a very pronounced lameness, you must immediately get a veterinarian involved. In addition to that, which Dr. Neff highlights in this clip, he talks about cryotherapy. Cryotherapy is this icing that goes on. And if you're unable to basically attend to this horse with this type of cryotherapy, that needs to happen over a 24, 48, 72 hour period of time. That really, it's in your best interest, in the horse's best interest, to take the horse to a clinic, because they have the infrastructure to sort of give the treatment that's necessary.
Then you also have to manage the pain and the cause. So managing the pain, things like non-steroidals, gabapentin, pregabalin, cryotherapy. Again, as Alvaro had mentioned, cryotherapy is absolutely huge. And one thing that I can't really stress more is that the clients need to understand, when you talk about cryotherapy, it's not 2 hours on, 2 hours off, 2 hours back on. The best way, if you're going to do the best thing for the horse, is 24/7, or however many days you're going to do it for. It's got to be 24 hours a day, and it's a management thing, and they need to understand that if they can't manage that themselves, that they should be referring the horse into some place whether it's a rehab farm or whatever that can manage that.
He's talking about in this clip, he's discussing like owner responsibility. There's only so much that we can do when we come out, but the reality is that the owners, it's going to require a great deal of management on their part insofar as being able to get this horse past this critical stage, this emergency stage with the horse. So, what can a farrier do? What does a farrier do? What does a veterinarian do? And basically, what has to happen is, and Dr. Palacios talks about in this clip,
between my bone and my shoe to derotate it and have a really nice bone alignment. And then I come with a ground PA that it should be between 18 to 20 degrees to release the forces of that deep digital flexor tendon.
Is as this bone is rotating, as this bone is shifting sort of down, we with our trim or the veterinarian with the trim, if they're also a farrier, basically are going to try to derotate the bone by trimming the heel. But at the same time, which is highlighted in the clip, is this deep flexor tendon is pulling on that bone, pulling the bone away from this dorsal aspect, this outside wall. And so not only are we derotating the bone, we also need to apply some sort of an appliance, some sort of a shoe, some sort of wedge, some sort of a lily pad that now increases the angle so to decrease the severity of the pull of the deep flexor tendon. And that's highlighted in some of the images of the appliances, the particular appliance that they used in the demo horse. One of the things that Dr. Palacios really drove home is you could have laminitis without rotation. Oftentimes you have this horse that's presenting foot soreness, digital pulse, heat in the foot. And basically, um, the normal course is to come out, take some radiographs, and you're not going to see rotation. Laminitis does not always need to have rotation. So that's where we have these instances where owners think maybe it's an abscess or some sort of an issue. Maybe it's just a foot unsoundness, but in some cases it may not be. In the demonstration with the demonstration horse, Dr. Palacios does what's called a venogram. Now, venogram, again, I've heard over the years different things about venograms. Venograms, if anything that I learned, is a very difficult thing to do in the field, especially if the veterinarian doing it may not have the level of experience that somebody like Dr. Palacios has. So a venogram is basically applying a tourniquet to the distal limb, restricting blood flow, at the same time injecting a contrast into the foot, and basically taking radiographs, as I highlight in some of the images that I'm sharing with you, taking radiographs of the foot, being able to see blood flow and the blood vessels in the foot. And you can clearly see how many blood vessels there are and this ability to see where all these blood vessels are. The key with the venogram, as Dr. Palacios really drove home, is it needs to be executed correctly, and there is a timeliness to its execution and ability for it to give you a true read of what's going on insofar as blood flow in the foot. So if I'm quoting him correctly, there's about a 30-second window from the time that the contrast is injected in till the time that you take radiographs, where that picture, as time uh, expires, as time goes on, you don't get as clear of a read of the blood vessels, the blood flow, and some of the images I'll share, there's like a fuzziness, the clarity begins to decrease, and that he talks about that. He also talks about the reason why you would do a venogram, and if it's properly executed, is he can actually see, and in some of the images you'll see he's pointing to a particular area, probably around where we see externally the coronary band. He's looking at the papillae, and he talks about how they change their inclination, and the change of the inclination is basically telling me that the blood flow is being negatively affected. And blood flow is really, and the restriction of blood flow is really one of the results of laminitis. So if you have somebody that's able to do the venogram, if you have somebody that's able to do it correctly, there's a tremendous amount of value in doing the venogram, because again, they demonstrate in this horse, and the video will basically highlight, is a horse that has been unsound, barefoot, ongoing lameness, hadn't been trimmed in a while. There could be the chance that they've had some sort of an episode, a laminitic episode, and determining that by placing that appliance, and this is another point that they, you know, when you have a horse that has this issue, you're able to sort of counteract it. You're putting these appliances on to sort of derotate, de-stress the deep digital flexor tendon. Now you have to manage this horse correctly. And the reality is, in these first initial days, weeks, maybe even months, a lot of hand walking. It's unrealistic to turn horses out, to create additional stress. So there's a lot of management that goes into, a lot of care and management. And veterinarians that are really have experience in this particular area, they would advise owners about all this type of stuff. So great clinic. Really glad that I was able to partake. Learned a lot, learned about this critical 24 hours, learned about the cryotherapy is a must. You have a sore-footed horse, ice it immediately, reduce the inflammation immediately, get the veterinarian out, check it out, have a farrier that is able to, willing to work with the veterinarian that has a certain degree of experience, a level of expertise to work in these types of critical cases. Because everybody working in tandem, a lot of horses that I have come across, if it's caught early enough, within a month or two, basically are able to restore sort of a certain degree of normalcy. Some other horses, it may definitely take longer. So great clinic. Check out Eastern Ontario Farriers Association. Check us out next month, November 15th. We'll be talking to Dr. Maria Katzimani, a licensed psychologist here in New Jersey and also in New York. Trainer, does a lot of good stuff working with people, working with horses with behavioral issues. So look forward to that. Thanks as always for stopping by. Please like and subscribe, and I'll see you next time on Shoenn with Jude. Thanks for stopping by.